Hey everyone, and welcome back to Stateside Health Scoop. So glad to have you joining us again for another deep dive into some seriously important health news. Today we're tackling the CDC's brand new recommendations for the COVID-19 vaccine.
It's definitely something we all need to stay informed about.
Absolutely. Now you've probably heard about this second booster dose they're suggesting, especially for anyone over 65 or if you're immunocompromised. But the big question is why now? What's the science behind this new recommendation?
Well, I think it's really interesting because what we're seeing is a change in how we think about COVID-19 vaccination. It's not just a one and done thing anymore. It's becoming a lot more personalized, tailored to individual needs, and really responding to how the virus itself is changing.
So it's not just a static thing. We're constantly learning.
Precisely.
So let's break it down a bit. Who exactly needs this second booster? We know it's people 65 and older and anyone who's immunocompromised, but why those groups in particular?
These groups are simply at a higher risk of getting really sick from COVID-19. As we age, our immune systems just naturally don't work as well as they used to. That makes us more susceptible to serious complications. And then for those with compromised immune systems, their bodies just can't put up as strong a fight against the virus, even if they are vaccinated.
So it's about protecting those who are most vulnerable.
Exactly.
Okay, that makes sense. But why a second booster now? Didn't we already have an updated vaccine rolled out?
Yeah, we did have an updated vaccine, you're right. But we have to remember, this virus is tricky. It's constantly evolving. New variants are emerging all the time.
Seems like it just won't quit.
Right. And the CDC, they're closely monitoring all of these new variants and looking at how well the vaccine is working against them. What they're finding is that while the updated vaccine is effective, that extra booster dose can give an even stronger layer of protection, especially for those at higher risk.
So it's about staying ahead of the curve, basically. It's not just about new variants. It's about making sure we're staying protected. Now, what about long COVID? Does this booster help with that at all?
That's a really crucial point. What we're seeing from the data is that getting vaccinated, including getting this second booster, can significantly lower your risk of developing long COVID, which, as many people know, can have really serious long-term effects on your health.
Okay, so we're talking about reducing the risk of severe illness, hospitalization, and even long COVID. That's a lot to consider, but this shared decision-making concept for those who are immunocompromised, that's really interesting to me. Can you explain a bit more about what that actually looks like?
Sure. Imagine you're sitting down with your doctor, having a conversation about your personal health situation. Maybe you have a particular condition, or you're taking medications that affect your immune system. In those cases, 2 booster doses a year might not be enough.
Wait, so some people might need even more than 2 boosters a year.
It's possible, but it all comes down to personalized care. Your doctor will look at your individual needs, consider the latest scientific research, and help you make an informed decision that's right for you. This approach empowers patients to be active participants in their own healthcare, which is really important.
Yeah, I can definitely see how that would be empowering, especially for people who are already managing some tough health challenges. So it's like we're moving away from a one-size-fits-all approach and towards a more personalized and adaptable model.
Exactly.
Now, I'm curious about how this shared decision-making actually works. Are there specific things doctors are looking at when they make these recommendations?
Absolutely. They'll look at your specific condition, any medications you might be taking, your overall health history, even your lifestyle factors. For example, someone going through chemotherapy might need a different vaccination schedule than someone managing a well-controlled autoimmune disorder.
So it really is about looking at the whole person and tailoring the recommendations to fit their needs. It sounds like doctors are really becoming partners in this whole process, helping people navigate the complexities of COVID-19 vaccination.
That's a great way to put it. They are partners. And that open communication is essential. And that open communication, it really is key. But let's take a step back for a moment. We've talked a lot about why we need this booster right now, but what does it all mean for the future of COVID-19 vaccination in general?
That's a great question.
Yeah.
I mean, is this going to be a yearly thing now, like the flu shot?
It's definitely a possibility. COVID-19, it's pretty clear that it's not going away anytime soon, right? And we're going to have to adapt how we deal with it.
It seemed like it.
The CDC and the Advisory Committee on Immunization Practices, they're always analyzing new data, looking at new variants, seeing how well the vaccine is working, and tracking overall transmission patterns. They're really working hard to stay ahead of the curve, and that means the recommendations we get might change as we learn more.
So we have to be flexible, basically. We have to adjust our approach as we go along.
Exactly. It's like we're in this dance with the virus, constantly trying to adapt to its moves.
That's a great analogy. It really emphasizes how important it is to stay informed and talk to our healthcare providers. They're the ones guiding us through these steps.
They are, absolutely.
Speaking of staying informed, where's the best place for people to go to get the most up-to-date, reliable information on COVID-19 and the latest vaccination recommendations?
The CDC website is a fantastic resource. They have a ton of information, the most current recommendations, data on safety, answers to frequently asked questions, and even resources to help you talk to your doctor about getting vaccinated.
So it's like a one-stop shop for all things COVID-related.
Pretty much.
Okay, awesome. So we've covered a lot today. We talked about who needs this second booster, why it's so important, the science behind it all, and that really interesting shared decision-making approach.
Yeah.
But before we wrap things up, I'm curious to get your expert take on something. What factors do you think might influence future vaccination recommendations? What should people keep an eye on?
That's a really thought-provoking question. One big factor, as we've already touched on, is the emergence of new variants.
Yeah.
If we see a new variant pop up that's significantly different from what we're dealing with now, we might need to adjust the vaccine itself.
Kind of like how they update the flu vaccine every year to match the strains that are circulating?
Exactly. Another thing to consider is how long the protection from the current vaccines actually lasts. We're still figuring that out, and that data is going to play a huge role in determining how often we'll need booster doses.
That makes sense. And I imagine the overall severity of COVID-19 is going to be a factor too, right? If we start seeing a major decrease in severe cases and hospitalizations, that could lead to different recommendations.
Absolutely. The ultimate goal is to find that sweet spot where we're protecting public health but not disrupting people's lives too much. It's an ongoing process, and as we learn more about the virus and how it impacts us, we need to be ready for those recommendations to change.
It's a constantly shifting landscape, but it sounds like we have the tools and the knowledge to navigate it.
We do. Staying informed, talking to our doctors, and being adaptable are key. Remember, this isn't a sprint. It's a marathon. We need to pace ourselves, stay informed, and work together if we want to stay ahead of the game.
I like that. It's a marathon, not a sprint. We're all in this together. I love that analogy. A marathon, not a sprint. We are all in this together. Well, we've covered a lot of ground today. We talked about who should be getting this second booster, why it's so important, all the science behind it, and that shared decision-making approach, which I think is great. Hopefully you're feeling a little more informed, a little more empowered to make healthy choices.
It's been great chatting with you, really exploring some of these more complex topics. And remember, knowledge is power. Staying up to date on the latest developments is one of the best ways we can protect ourselves and everyone around us.
I totally agree. So as we move forward in this ever-changing landscape, remember to stay curious, stay informed, and definitely reach out to your healthcare provider if you have any questions at all. They're your partner in all of this.
They are. And remember, we're all learning as we go.
That's what's so great about science, right? It's this ongoing journey of discovery, always refining what we know. And on that note, we're going to wrap up this deep dive. Thanks so much for tuning in, and we'll see you back here next time for another insightful look at the world around us. Be sure to like this video, subscribe to the channel, and hit that notification bell so you don't miss out on any future deep dives.